recording a second video about preventing blackheads. I'd structure it as the next level guide. How to keep pores clear long term. How to choose products without getting trapped by marketing. And how to troubleshoot the most common reasons blackheads keep coming back even when you're doing everything right. As always, this is general education, not personal medical advice. If you have severe acne, scarring, eczema/rosacea, or you're pregnant/nursing or using prescription products, it's best to check with a qualified clinician before changing your routine. Let's begin with an idea that instantly reduces frustration. Preventing blackheads is not about having perfectly clean skin, and it's not about forcing pores to look invisible. Pores are structures that house hair follicles and oil glands. They are supposed to be there, and they are supposed to transport oil to the surface to protect the skin barrier. The goal is not to erase pores. The goal is to keep the flow inside the pore balanced so oil and dead skin don't form a stubborn plug. When you focus on flow and barrier health, prevention becomes more predictable and far less irritating. A big reason blackhead prevention fails is because people treat blackheads as dirt. They scrub, they use harsh cleansers, they overwash, and they keep trying to pull out plugs with strips or aggressive extraction. That approach often backfires. When the barrier gets inflamed, your skin can swell around pores, the pore lining can become stickier, and shedding becomes less orderly. That combination makes it easier for clogs to form. So the first step in prevention, especially for persistent blackheads, is to stop the cycle of irritation. If your routine leaves your face feeling tight, stinging, red, or constantly flaky, your skin is not being purified, it's being stressed. Stressed skin is more reactive and often breaks out more. Now let's talk about what persistent blackheads are really telling you. If blackheads keep returning quickly, usually one or more of these is happening. You're not removing sunscreen and makeup fully at night. Your pore lining exfoliation isn't consistent enough. Your active ingredients are too strong and causing rebound irritation. You're using pore clogging textures in the areas that trap oil. You're over-extracting and inflaming the pore opening. Or you're missing a simple trigger like hair products, sweat plus friction, or heavy occlusion in the T-zone. The fix is rarely, buy 10 new products. The fix is usually small adjustments done consistently. Start with the most underestimated step, nightly removal of sunscreen. Sunscreen is essential for skin health and for acne prevention when you use active ingredients, but it's also designed to stick to the skin. If you apply sunscreen in the morning and don't remove it properly at night, you're giving your pores an extra layer to push through. Over time, this can contribute to congestion. You do not need harsh soap to solve this. You need a removal method that actually dissolves what's on the skin. For many people, this means a simple first cleanse at night with micellar water, cleansing oil, or cleansing balm, followed by a gentle water-based cleanser. If you prefer one step, you can still do it, but you must massage long enough and rinse thoroughly. The quick splash and go approach often leaves residue. A good test is how your skin feels. It should feel clean and calm, not squeaky, not tight, and not filmy. Next, let's clarify the difference between managing sebaceous filaments and preventing true blackheads. Sebaceous filaments are normal. They are like tiny channels where oil travels. They tend to look like small, uniform dots, especially on the nose. They refill quickly, sometimes within days, even with a perfect routine. True blackheads are more distinct, darker, and behave like acne lesions. Many people have both. If you try to eliminate every sebaceous filament, you'll usually overtreat your skin and create more irritation. A better goal is to smooth the look of pores and reduce the number of true blackheads, accepting that some pore visibility is normal and healthy. Now we'll get into the core prevention tools, but with a more strategic approach than use everything. Think of blackhead prevention as a three-pillar system: normalize shedding inside the pore, support the barrier, and reduce triggers that overload the pore. The normalized shedding pillar usually comes from one of two ingredient families, salicylic acid or retinoids. Salicylic acid, a beta-hydroxy acid, is oil-soluble and can penetrate into the pore lining to loosen the mixture of oil and dead cells. Retinoids normalize cell turnover and reduce the tendency of cells to stick together inside follicles, which prevents microclogs from becoming visible blackheads. Both work, and many people do best with one as their main tool, not both every day. If you choose salicylic acid as your main prevention active, the success formula is gentle and consistent use. A leave-on salicylic acid product can work extremely well, but only if your barrier stays happy. That means you start at a low frequency and increase gradually. Many people do great with 2 to 4 nights per week. If you have very oily skin and tolerate it well, you might use it more often, but daily use is not automatically better. If your face starts feeling dry, burning, or sensitized, you won't keep using it, and inconsistent use leads to inconsistent results. A short contact salicylic cleanser is another option. It's generally gentler because it doesn't sit on the skin as long, though it can also be less potent. For prevention, potency isn't everything, tolerance is. If you choose a retinoid as your main prevention active, treat it like a long-term training plan, not a sprint. The biggest mistake I see is applying too much too often too soon. A pea-sized amount for the whole face is enough. Apply it to completely dry skin at night, then moisturize. Start 2 nights per week, build to every other night, then nightly if your skin is comfortable. Buffering with moisturizer is not weak, it's smart if it helps you stay consistent. Retinoids often deliver the best results at 3 to 6 months, not 3 to 6 days. Also, retinoids can increase sensitivity, so daily sunscreen becomes non-negotiable. If you are pregnant, trying to conceive, or nursing, do not start a retinoid unless a clinician specifically approves a safe alternative for your situation. Now, what about combining salicylic acid and retinoids? It can be done, but the best approach is usually alternating nights, not layering them together. Your skin barrier is the gatekeeper of long-term success. If you overstrip it, you may get more redness, more oiliness, and more breakouts. A practical schedule is using a retinoid 2 or 3 nights a week, salicylic acid 1 or 2 nights a week, and the remaining nights focusing on hydration and barrier support. This reduces irritation while still addressing the pore from multiple angles. Barrier support is the second pillar, and this is where many acne routines quietly fail. When the barrier is compromised, the skin can become inflamed and reactive, and pores can clog more easily because shedding becomes less coordinated. A good moisturizer for blackhead-prone skin doesn't have to feel heavy. Look for ingredients that support hydration and barrier lipids like glycerin, ceramides, panthenol, and sometimes niacinamide. Niacinamide can help reduce the look of enlarged pores for some people by improving texture and regulating oil. If you're sensitive to niacinamide, don't force it. A simple moisturizer is better than an irritating, perfect one. Let's also talk about cleansing in the context of barrier support. If you cleanse with something harsh, you can sabotage your own prevention routine. Choose a gentle cleanser that doesn't leave your skin tight. Cleansing twice a day is enough for most people. If you're very dry or easily irritated, you may do best cleansing only at night and rinsing with water in the morning. If you're very oily, you can cleanse in the morning too, but don't keep washing throughout the day. Frequent washing can increase irritation and sometimes increase oil production in response. The third pillar is trigger control, the small environmental and product factors that repeatedly overload pores. One of the biggest triggers is occlusion plus sweat. Think about masks, helmets, sports straps, tight hats, or anything that traps heat and humidity against the skin. This environment swells the pore opening and increases oil and sweat, making clogs more likely. The prevention answer is not scrubbing harder. The answer is gentle cleansing after sweating, avoiding heavy occlusive products in that area, and using a tolerable pore-clearing active on a consistent schedule. If you can't cleanse right away after a workout, even a rinse and gentle pat dry is better than leaving sweat and sunscreen sitting on the skin for hours. Hair products are another huge trigger, especially for forehead and temple blackheads. Pomades, oils, thick conditioners, and leave-in products can migrate onto the skin and clog pores along the hairline. If your congestion clusters around the hairline, the fix might be as simple as keeping hair products off the skin, rinsing thoroughly, and washing your face after styling. Also consider how you sleep. If hair coated with product rubs against your cheeks at night, it can contribute to clogging. Clip hair back or use a clean pillowcase. Pillowcases don't cause acne on their own, but they can be one more variable that makes it harder to keep pores clear when combined with oil and sweat. Makeup is not automatically the enemy, but removal is everything. Heavy foundation layers, thick concealers, and frequent touch-ups can contribute to congestion if they aren't removed well. Choose formulas that feel breathable, and clean your tools. Makeup brushes and sponges accumulate oil, old product, and bacteria. If you're prone to blackheads, washing tools regularly is one of the simplest prevention wins. Now, let's address extraction because it's such a common topic. Manual extraction can be done safely by a trained professional, but at home it often becomes overly aggressive. When you squeeze, you can rupture the pore lining and create inflammation. Inflamed pores often refill faster and look larger. If you must do occasional at-home maintenance, keep it minimal. Do it after a warm shower, use clean hands and gentle pressure, and stop immediately if the plug doesn't release easily. Never dig with sharp tools. Never pick until the skin breaks. The goal is to prevent blackheads, not to chase them every day. If you love that clean pore feeling, a weekly clay mask can help absorb excess surface oil, but it should never leave your skin cracked and tight. Apply it for a short time, rinse before it fully dries, then moisturize. Product selection is another area where people get stuck. The label, non-comedogenic, can be helpful, but it's not a guarantee. What matters most is how your skin responds and whether the product's texture suits your pore-prone zones. Many people do well using lighter textures on the nose, inner cheeks, and chin, and reserving richer textures for drier areas like the outer cheeks. If you love facial oils, use them sparingly, mix a drop or two into moisturizer, and avoid applying oils directly on the areas where blackheads are most active. If you use petroleum-based ointments, which can be excellent for healing and barrier repair, keep them for dry patches rather than covering the entire T-zone daily. Let's also cover common myths so you can avoid wasting time. Blackheads are not caused by dirty skin, and harsh scrubs do not prevent them, they often worsen them. Pores do not truly open and close, but they can look larger when they're filled or when the surrounding tissue is inflamed. Steam can temporarily soften debris and make extraction easier, but it doesn't detox pores, and too much heat can irritate sensitive skin. Toothpaste, lemon juice, baking soda, and other DIY hacks are risky and can burn or sensitize the skin, making acne worse and causing dark marks. Consistent, gentle routines beat extreme hacks every time. Now we'll make this extremely practical with a routine blueprint that adapts to different skin types without becoming complicated. Imagine your routine like a simple daily rhythm. In the morning, you cleanse gently if you need it. If your skin is comfortable, you can skip cleanser and rinse with water. Then apply a lightweight moisturizer if you're using actives at night or if your skin feels tight. Then apply sunscreen. That's it. In the evening, you remove sunscreen and makeup fully, then cleanse gently. Pat the skin dry. Apply your main active on dry skin. Wait a moment for it to settle, then apply moisturizer. The order is simple: cleanse, treat, moisturize. If you try to stack too many steps, you increase the chances of irritation and inconsistency. If you want a beginner-friendly prevention plan, start with salicylic acid 2 to 3 nights a week for 4 weeks. Keep everything else gentle. If your skin is calm and you want more results, increase to every other night. If your skin gets dry, reduce frequency. If after 2 to 3 months you still have stubborn blackheads, consider adding a retinoid slowly or consult a dermatologist for prescription options. If you want the retinoid plan, start 2 nights a week for 4 weeks, then increase gradually. On the nights you don't use retinoid, focus on moisturizer and barrier calm. You may wonder how long prevention takes to show results. This matters because impatience leads to overtreatment. For salicylic acid, many people notice smoother texture within a few weeks, but more visible blackhead reduction often takes 8 to 12 weeks. For retinoids, meaningful improvement often begins around 12 weeks and continues to improve for 6 months or more. The time frame is not a sign of weakness, it's the biology of how pores turn over. The most effective strategy is to choose a plan you can repeat calmly for months. Let's talk about purging, because it can confuse people and cause them to quit. Retinoids can trigger a temporary increase in breakouts as microclogs come to the surface. A true purge usually happens in the areas where you already break out, and it gradually improves over weeks. If you get new rashes, burning, severe redness, or breakouts in places you don't normally break out, that's more likely irritation or a reaction, not purging. In that case, stop the product and simplify. Skin should feel calmer as it improves. You don't need constant discomfort. Some people have persistent blackheads because their skin is both oily and sensitive. In that case, the solution is not more force, it's better tolerance. Try lower strength actives, use them less often, and commit to barrier support. A short contact salicylic cleanser can be gentler than a leave-on. A mild retinol can be easier than a strong retinoid. Moisturize consistently. Think of your skin like a team. If the barrier is injured, the pore-clearing actives can't do their best work. Calm skin responds better. If your blackheads are concentrated on the nose, you can target that area more frequently than the rest of the face. Many people do well applying a thin layer of salicylic acid on the nose and inner cheeks more often, while keeping the rest of the face gentler. But again, don't treat the nose like it's indestructible. Over-treating the nose can lead to flaking and redness around the nostrils, which is uncomfortable and can make pores look worse. Shaving can also influence blackheads, especially in areas where hair follicles are dense. Shaving irritation and ingrown hairs can combine with congestion. If you shave, use a gentle shaving gel, avoid going over the same area repeatedly, and moisturize afterward. If you use a strong active like a retinoid, you may want to avoid applying it immediately after shaving because freshly shaved skin can be more sensitive. Now, let's talk about lifestyle factors in a balanced way. Diet is not the sole driver of blackheads, but it can influence oil production and inflammation for some people. If you notice your skin gets oilier and more congested after high-sugar foods or lots of refined carbs, aim for steadier blood sugar with more fiber and protein. Some people notice acne worsens with dairy, especially skim milk, though the effect varies. If you want to test this, do it as a calm experiment for several weeks rather than making extreme restrictions. Hydration supports comfort but won't flush out blackheads. Supplements are not a first-line prevention plan, and they can have side effects, so treat them cautiously. Stress and sleep matter, too. Chronic stress can increase oil production in some people, and poor sleep increases inflammation. If your life is stressful, your best skin move is to keep your routine simple and gentle rather than chasing harsh quick fixes. Consistency is easier when the routine is calm. When should you consider professional help? If you have very stubborn congestion, if you're developing scars, if you have painful cystic acne, or if acne affects your confidence and mood significantly, it's absolutely reasonable to see a dermatologist. Professional extraction, chemical peels, and prescription retinoids can be transformative when done safely and paired with a good home routine. A professional can also help you confirm whether you're dealing with blackheads, sebaceous filaments, or another condition like milia or acne mechanica. Here's a mindset shift that helps people stay consistent. Prevention is not a one-time cleanse, it's maintenance. Pores are constantly producing oil and constantly shedding cells. The routine that works is the routine you can live with. If your plan feels like a punishment, you will either quit or your skin will become irritated, and both outcomes bring blackheads back. If your plan feels manageable, your skin stays calm, and calm skin clears more reliably. So for this second video, I want you to remember the main takeaways. First, blackheads are an inside-the-pore traffic problem, not a dirt problem. Second, pick one main pore-clearing active, most commonly salicylic acid or a retinoid, and use it consistently without irritation. Third, protect your barrier with gentle cleansing, moisturizing, and daily sunscreen. Fourth, remove sunscreen and makeup thoroughly at night, because residue is one of the sneakiest causes of congestion. Fifth, reduce triggers like hair products on the face, sweat plus friction, and heavy occlusion in the T-zone. And finally, give your skin time. If you stay steady for 8 to 12 weeks, most people see meaningful improvement, and with retinoids, the gains often continue for months. If you record this as a voiceover, the tone should feel reassuring. you're guiding the viewer away from harsh, quick fix culture and toward a calm, sustainable routine.